I manage my life. I have a better understanding of the condition from a biological standpoint, medical standpoint. I had a good understanding of healthy options of physical fitness and of dietary good sense and how to manage my pain.
With osteoarthritis, pain results from changes in the joint, including loss of cartilage, the addition of bony overgrowths or bone spurs, and inflamed joint tissue lining.
Our bones are rich with nerves and blood vessels. Cartilage is like a cap that protects those nerves and blood vessels. As that deteriorates, then you have the bone on bone, you have those nerves against each other. That's the pain you feel.
Acute pain is generally intense but temporary. It's nature's way of telling you to stop. The pain usually leaves when injury or disease has healed. This is unlike the chronic pain of osteoarthritis. Here, although your body is giving you a pain message, it's important to stay as active as possible. The challenge is learning how to stay active while protecting your damaged joints. With osteoarthritis joint pain, if you try to heal it just by resting, you may find yourself in a pain cycle. Pain can make you stop moving, lose sleep, become fatigued, stressed, and depressed, all of which leads to more pain. But if you change one part, you can change the entire cycle.
Day-to-day tasks were becoming so physically painful that emotionally I couldn't handle it. And on top of that, because I was in so much physical pain and restriction, my lifestyle had changed. So I wasn't seeing friends as much, so my social network was reduced. And yeah, so depression set in. And so what I did was I went to my doctor first, and he put me on antidepressants. And he was very clear in explaining that this isn't going to take away the pain, but it will help to take away my emotional attachment to the pain. And I went for counseling. And again, it was just going to be able to talk to somebody to just be able to process the fact that it's natural to feel depressed when your life has changed. And there's something about
Osteoarthritis pain may change from day to day. You may feel fine one day, and then after doing too much activity, have a flare-up. A flare-up or acute episode involves inflammation of the joint. The signs are swelling, redness, heat, tenderness, and not being able to move the joint easily.
Always listen to your body.
Manage a flare-up by resting the joint, but stay active at the same time. For example, if your knee is swollen and painful, gentle movement helps to limit the amount of stiffness so that you recover faster. Also, continued gentle activity keeps your other joints strong and flexible. Plan activity and rest periods, but limit naps. Make use of aids such as a cane, crutches, or walker to rest the joint. Learn how to use these aids before you need them.
And when I move, I bring the cane forward with my diseased leg, and this way 40% of my body weight is going through the cane instead of through my diseased joint. So in that way, a cane can be very useful. And just because you're using it through a flare-up or through a rough patch doesn't mean you're locked into cane use forever. It can be just a temporary strategy, or if it's what helps you get around, so be it. Now, one other thing
Try using ice during a flare-up in joints like the knee. Ice reduces inflammation, pain, and swelling. Be sure to place a layer of material between your skin and the ice. Apply ice for a maximum of 15 minutes, repeating hourly as needed. If you have questions about using ice, talk to a healthcare provider such as a physiotherapist for more information.
You know, I hear good things and bad things about the use of heat for pain. Do you have any comments on that?
I do. Actually, heat is a great strategy, but it depends on how your joint is doing. If you have a joint that's in the midst of a flare-up where it is swollen, painful, throbbing, putting heat on is going to aggravate the inflammation. So we don't recommend using heat if you feel any degree of throbbing in the joint. If, however, you're using heat in order to help loosen up your joint and get more active, he can be a great strategy. A warm shower, a warm bath can promote blood flow to the area and increase flexibility in the joint and help you get active.
I tend to use heat and moist heat. I spend more time sitting in a warm bath than I've ever in my life, and that really feels good.
Medication is another helpful strategy in dealing with osteoarthritis pain. Medication may reduce inflammation, help you stay active, treat depression and anxiety, and help you sleep.
Some people are really apprehensive about medication for the same reason they're apprehensive about using a cane. If I have a chronic health condition, I start taking medication, then I'll never stop. Well, just as you can have a flare-up of your disease, you can have periods of time where you need medication, periods of time where you don't. So
Pain medication works better if you take it before the pain gets bad. If you wait until the pain is severe, the medication doesn't work as well, which can be very frustrating. Be sure to follow your physician's advice and read the labels on all medications. If you know you are going to do an activity that has made your arthritis pain flare up, take your pain medication on a regular basis before and after to prevent the pain from getting bad.
You know, you need to take medications, early. You need to avoid flare-ups so that you can get out. And you need to listen to your body. You have to respect what your body's telling you.
And that's very important, to time your medication with an activity. If you want to have an afternoon of an increased activity, well, take something for it an hour before you do that.
It's always a good idea to talk to your doctor and/or your pharmacist about your pain medications and about how much and how often you're taking them,
Yeah, it is.
so that they can monitor you for side effects like high blood pressure or changes to kidney and liver function.
What pain medication can I be taking for my osteoarthritis?
Probably the best to start with is Tylenol. Over the counter, one could also add in or even use alternatively some Advil, which is also over the counter.
Okay.
That works a little differently than Tylenol. It has both anti-inflammatory and pain-killing properties. Some people find that one works better than the other, and often, when used together, work better than either individually. The prescription arthritis medications, by and large, tend to be relatives of Advil, and tend to have the same kind of side effect profiles, so they can bother the stomach. There are some medicines that can protect your stomach from the Advil, and in some individuals we have to be careful with the effects on the kidneys and the liver, and the effects on the kidneys in fact can lead to a bit of an increase in the blood pressure, in some cases a bit of fluid retention.
Okay. Now, as you know, I am taking medication for other conditions in my life. Would these conflict with my osteoarthritis medication?
It's really important for me as your physician to know what you're taking, and I include complementary medications with that as well, because there are potential interactions between many medications and arthritis medications. And we sometimes have to tweak the blood pressure medications a bit. And again, we have to be vigilant about potential effects on the kidney.
I've heard of people using pepper cream. Can you tell me what that's all about?
Sure, that's available over the counter. Capsaicin is the generic name. And it does have a pepper, the active ingredient is something that we think interrupts the pain signal back to your brain. And some people, in fact, get quite good relief. And not everybody tolerates the cream. Some people find that they get a fair bit of burning with the cream, so that's something you won't know until you try it.
Right. What if the medication stops working?
No, if they're no longer managing your pain, there are some even stronger painkillers that we can use. Mm-hmm. And then, of course, it may be necessary to go to surgical alternatives.
Really? Should I be keeping track of all the medication I'm taking, like every pill?
It's very helpful for me to have a sense of whether your medication utilization is stable and at what level, whether it's increased a bit, whether it's decreased a bit. The more you know about the medications, about the side effects to look for, about the benefits, being in tune, what helps, what doesn't help with your own body, there's no question that you'll be more successful in using those medications to manage your arthritis and to optimize your activity.
Good.
Don't try to control your pain through medication alone. Medication is only one part of pain management. Getting a good night's sleep can help reduce your pain. If you have problems sleeping, try going to bed and getting up around the same time each day. Relax at bedtime by having a warm bath or listening to soothing music. Stop eating or drinking 2 to 3 hours before bedtime. Be aware that daytime napping may affect your nighttime sleep. If sleep has been a problem, it may be time to get a new supportive mattress.
I've done acupuncture and I'm still doing it, and massage I go for regularly, once a week, and that really seems to help.
Some people benefit from complementary therapies such as massage, chiropractic, acupuncture, and meditation. Pain can affect your moods and emotions, and in turn, your moods can definitely affect how you feel pain. So it's important to have some strategies to keep your brain focused on things other than the suffering your joint may be causing you.
Every time I'm with other people, conversation of other persons, their contribution causes new possibilities in my own thinking, and the information becomes reinforced.
Getting out in the world, being connected to people and having a laugh and having some pleasure in life is as important a pain strategy as medication or massage or any of those other ones. So trying to stay socially connected and trying to improve your mood can improve your pain experience.
There's lots of events in my working life that are out of my control, and it stresses me out. When that happens, I get more pain. Yeah, so relaxing and keeping cool about everything is just, if something happens, you can control it, so be it. You can't control it, so relax.
If you accept a higher degree of pain, you're accepting a lower degree of function in your life. And so I think it is very important that you learn how to advocate for yourself in identifying your pain, identifying your good times, bad times, strategies that work, and being really proactive about how to deal with your pain.
Yes. Oop.